Hey everybody, I'm Craig.
And I'm Brittany.
And today we're going to talk about ankle and foot stabilization. Specifically, we're going to talk about fallen arches, when your foot just drops down into that flat position. Could be after an injury, could be after a knee surgery or hip surgery or any of those kinds of things. But we're going to use this little band here. Brittany's going to be our patient, and we're going to go through a couple of things here for you. So what are the reasons that a foot or an ankle can collapse?
So a lot of times you've probably heard like someone's flat-footed, right? And then if you look down at their feet, it looks like their arches are, looks like their arches are just kind of in line with the floor, right? So their navicular bone or that bone here, totally down, the arch is dropped, and there's no medial arch support. Right. So you've got a tendon that runs down the back of or down the side of the leg and helps to support that arch. And if there's either weakness in the tendon, if there's a rupture of the tendon, any of those things, then you get that foot drop or arch drop, not foot drop.
So that's one of the reasons why you can have it. The other thing is, and I just wrote an article today, it'll be posted on our site at iptvirtual.com. Go check it out on our blog site. Are you duck-footed? Duck-footed basically means, are your feet turned out? So if you're standing, you march in place, and then you just lay your feet down and your feet turn out, that's basically what we call duck-footed. Now that could be caused by rotations in the hips, it can be caused by rotations in the knee, or it could be coming from a weakened or inaccessible ankle stabilizing musculature that creates a downward motion or pronation of the foot. Now, let's talk about bunions for literally 2 seconds. A bunion is that darn it. The bunion is the bone structure where the tendon is pulling. Now we can fix the bunion, but we got to fix the reason why the bunion occurs. And if that's coming from the hips, well then we got to work on those hip rotators as well as knee and ankle stabilizers to make sure that if you choose to fix your bunions, please do. Make sure you take care of the rest of the body.
So we're going to show you what to do with some exercises at home if you are having that flat foot experience.
So today we're going to use this little band here. You can use TheraBand, anything that gives some good stabilization, and we're going to start with this in a barefooted position. So when you're ready, take off those socks and shoes and let's get down onto the floor here. All right, so we've subbed out Brittany for a foot and ankle model. Apologies for that. And again, what I've got is this band right here, and what I'm going to do is ask our model just to stand up real tall and just take a look and see what's going on in the foot. Now, if this was a situation where this ankle was rolling down inward, you would notice this kind of turn in, the knee might turn in a little bit, and you'll see this whole structure in the front of the foot drop down. So what we're going to talk about right now is, it's a little bit technical, but don't worry about it too much. Short foot versus long foot. In other words, the exercises we're going to do today do not involve curling the toes. Show me what curling the toes looks like. Just like that. We don't want that. We want to create what's called a short foot, or the big toe, this med head right here, we want to be able to push that down into the floor and lift up through the arch. Okay? So that's what a short foot would look like. And again, show me what a long foot might look like, where you curl those toes, right? That's not what we want. So what we're going to do right here is I'm going to just take this band and I'm going to bring it right down to the bottom of the ankle, try go underneath that ankle bone, and I'm just going to give a little bit of a tug this way. And what we're going to try do is we're going to allow that foot to drop down towards and collapse the arch intentionally, and then slowly allow that arch to come back up. Now the key here is making sure that this big toe stays down on the floor, okay? And as we drop down, you'll see the foot collapse, but then we'll bring it back up and allow it to come there. Let's show you what not to do. Allow this foot to roll all the way over, and we've now lost our stability. See that? We want to keep that foot, this mid part of the foot down, engaged on the floor, and we'll allow that arch to come up, okay? Now this is correcting of the arch, allowing you to feel what it might be like. And in a moment, I'm going to switch sides, and we're going to do this exactly from the other side to help create that short foot position. And another thing that we can do here is, if we find that the foot is going into that long foot or curled position, what I can do is take a band and put it underneath the toe and anchor it out here. That way, she's not going to be able to claw on that foot. She's going to have to keep that foot down, and I'll show you how to do that on the other side. So I'm coming over here. We're going to use the same foot, so I'm going to have stand up real tall for me, And with this band, I'm going to have her lift up there and just on the big toe, right? Now this band, if it was pulled out nice and strong, she's got to hold that band in place. So move this foot back for me just a little bit. Good. And that gives me access now to the ankle. And again, just below that there. And I'm going to use my foot here to put a little tension in that band. Okay? So now let's create that arch again. Hold there. And notice how that big toe has to stay in place because that band is being required to be held there. The band that I'm pulling on here will drop her further down into an arch. And then we want to lift back up again. Hold that for 2 or 3 seconds and then come back down. And let's do that anywhere between 2 or 3 sets, about 10 to 12 repetitions each. This is how we create a short arch, a support of the foot and the ankle after any type of an injury. And thank you very much to our special foot model here. It's definitely not Brittany. You guys have a great day. Check us out on IPTV, on YouTube, Integrated Physical Therapy as well. We look forward to seeing you guys again soon. Take care. Have a great day.